Greetings on World Heart Day. Oftentimes, heart patients are told that they should reduce stress in life. And as one of my patients told me, the most stressful thing for him after his MI was that everybody was telling him, hey, reduce stress, reduce stress. And he said, that was so stressful for me. So what can a psychiatrist say about heart and health of heart? Stress is a big topic and there is so much that needs to be said. But today I am going to talk about one principle and two important tips, that's all. One very important principle is this, that whatever is good for your heart is good for your brain. And as you know, brain is the seat or organ for our thinking, for our emotions, for our intellect, for our cognition. And that is why heart health and brain health are two sides of the same coin. So remember, whatever is good for your brain is good for your heart. Whatever is good for your heart is good for your brain. The two important tips that I am going to talk about are, first, sleep. All over the world, most city dwellers on an average sleep 1 hour less than what they should be sleeping. We live in a culture where somebody sleeping less is admired. People boast, oh, I sleep only 3 hours, 4 hours. That's absolute nonsense. 1 in a million, somebody may need less sleep, but most of us need 7 to 8 hours of sleep a day. So make sure that you get enough sleep. Sleep is a big stress buster, just as exercises. So important thing is, remember to get adequate sleep. Second important tip that I'm going to give is, depression and heart disease have a bidirectional relationship. Heart disease often gives rise to depression, as in depressive disorder. And depressive disorders are a risk factor for heart disease. So make sure that if you are feeling depressed, if your sleep is disturbed, if your appetite is disturbed, you feel tired all day long, you don't feel confident, there are too many negative thoughts. So any of these things that continue for 2 weeks or more, you should seek consultation from a psychiatrist. Treating depression will help your heart. There are many antidepressants which are safe for heart disease. So these are the two important tips today. Get adequate sleep and make sure that you treat your depression to make sure that your heart also stays in good health. Obviously, other general health factors are important. Exercise is important. Being out in nature is important. To be with friends and family is important. But right now, these two important things that I highlighted should be kept in mind. Thank you and have a nice day.